budget hearing. First off today is the Alcohol, Drug, and Mental Health Board. I will turn it over to Erica Clark-Jones, their CEO, for today's presentation.
Thank you so much, Zach, and thank you to the commissioners and staff and County Administrator Wilson for allowing us to present this afternoon. I am joined today by a stellar team here at AdamH, and I will introduce them in the order you will be hearing from them this afternoon. My name is Erica Clark-Jones, and I serve as the CEO of your AdamH, or Franklin County Alcohol, Drug, and Mental Health Board. Meg Griffin is our Interim Vice President of Clinical Services, Jonathan Thomas, our Vice President of Planning and Evaluation, and Mr. Patrick McLean, who is our Chief Financial Officer. I also want to take this opportunity to introduce one of our newest team members, Dr. Aminat Kimavor. Dr. Kimavor joined the AdamH team earlier this week, and she serves as our new Vice President for Advocacy and Engagement, replacing someone who could never be replaced, Dr. Kevin Dixon. So this group and over 40 full-time employees are dedicated to improving the well-being of Franklin County residents through accessible, equitable mental health and addiction services delivered through our network of more than 30 community-based providers. Next slide, please. And by the way, we also have another team member, Ms. Shelley Hoffman, who's our Senior Director of Communications, who's helping make all of this go for you this afternoon. Great, thank you, Shelley. So Franklin County AdamH has a renewed and expanded investment in our community-based network with the recent passage of a 5-year countywide property tax levy in 2020, thanks to the voters. Coupled with the increased community behavioral healthcare needs intensified by the pandemic, there is no better time to redefine our path forward. We have spent much of the last year looking at how AdamH can be better positioned to fully deliver on our mission. Through organizational and county community assessments, we identified many opportunities to enhance the network and its 6 systems of care. Informed by that input, we have a strategic roadmap. We've refreshed our old strategic plan, renewed it for the future, and we have a strategic roadmap for the next 5 years to align with this new levy cycle. Next slide, please. That said, there is an urgency in our work. There are alarming behavioral health trends in our community that we want to make sure that others are aware of. The prevalence of mental illness was increasing in Ohio and nationally before the pandemic, and this was from 2019. This exceeds the commonly cited 1 in 5 statistic, according to a survey from SAMHSA, and now is at 21%. There is evidence that the pandemic has worsened our mental health. Nationally, Mental Health America's online screening program saw a 93% increase in anxiety screenings and a 62% increase in depression screenings. The results of their screening showed unprecedented levels of suicidal ideation since the program's inception in 2014. Locally, there has been an increase in mental health related dispatches, with Columbus Police Department averaging 65 dispatches per day in 2021. This is up from 61 calls per day in 2019 and 2020. Overdose deaths climbed 47% in 2020 to over 800 deaths in Franklin County. The peak was in May of 2020, when on average, there were more than 3 overdose deaths per day. And I know some of you followed the stories that were in the dispatch that has renewed those figures as early as this morning. This evidence, among other factors, supports an anticipated 23% increase in the need for mental health and substance use disorder services over the next 10 years. Next slide, please. With that acknowledgement, not all behavioral health needs are reflected in common community indicators that were listed on the previous slide. Our community needs assessment added more context for us to consider in our strategic planning, especially the input of our system's clients and their families. It is important to note here that our community needs assessment approach was community-wide. We did not limit it to just the AdamH network or to individuals and families that are currently served by AdamH funded services. When we did our community needs assessment, no one in Franklin County was excluded. What we learned was that there were many unmet needs in our community, with prevention and treatment having the largest overall service needs. And prevention, family supports, recovery supports, treatment services, all had the largest unmet needs. So there's a disconnect there. Communications, we also learned that communications not in a person's first language and that do not account for the cultural stigmas around behavioral health impact the quality of information that is conveyed. We must be more inclusive. The complexity of mental health and addiction and the interrelated factors, including social determinants of health that impact an individual's ability to achieve and maintain well-being, makes it necessary for our network to collaborate with other social services and systems of care. An example of that is the Community Shelter Board. We collectively have an opportunity to improve the perception of quality behavioral health services and the quality overall. And that community feedback suggests that building the capacity and increasing cultural relevance of services will help improve that quality. Next slide. Informed by these assessments that we talked about, both from the community and an organizational needs assessment of our staff, the Adam H. Board of Trustees recently adopted a refreshed mission and vision and a set of core values to better align to our statutory roles and requirements as a board and guide our responsive to support to the community as we move towards a Franklin County where everyone can achieve optimal health, optimal mental health and wellness, free from stigma, with equitable access to quality community-based services and supports. Next slide. Our strategic plan. Through our new strategic plan, 5 priorities will guide our work as we move forward. Our first priority is for the service delivery system. With our 30+ providers who are directly improving the lives of individuals and families in our community. That's our first priority. Next, measuring the impact of Adam H. and our investments to hold ourselves accountable as stewards of the resources entrusted to this board is our second priority. The third priority acknowledges the need to support and develop a robust and representative behavioral health workforce. I'm sure you have heard on many accounts that workforce is a challenge across many systems. Well, the behavioral health system should be included in that discussion. Next, strategic communications and engagement, including advocacy on policy-related matters to support the needs of our network and the people that the network serves is our next priority. And finally, the fifth goal is more internally focused to our operations and addresses the findings of our organizational assessment to become more efficient and effective in carrying out our statutory role. My last slide. Thank you. As you had asked, and as we quite frankly are proud to report on, we are also guided by the realization that delivering accessible, equitable, and culturally appropriate behavioral health care begins with our own organization. We established inside Adam H. a diversity, equity, and inclusion committee to take employee-informed approach to education and establishing alignment internally. We also recognize that there was more that we could do to broaden the base of Adam H. vendors, the vendors that Adam H. uses for its purchases of products and services, and we have incorporated guidelines for purchasing that expands the pool of companies that Adam H. does business with. Adam H. is also at the table working on statewide solutions. I serve on our statewide association's Health Equity, Diversity, and Inclusion Council, working to help Adam H. boards across the state and communities across the state to address racism and develop strategies to improve health equity and inclusion. We also submitted the first draft of our board's Health Equity and Cultural Competency Plan to the Ohio Department of Mental Health and Addiction Services this fall. Knowing that this is the lens from which all of our work must be viewed, we have also incorporated key actions into our strategic plan to address the delivery of culturally competent care through increasing the pipeline of diverse behavioral health providers and professionals. There's more work to be done, but we are confident that we are on the right path. Now, it's my pleasure to introduce Meg Griffin, our Interim Vice President for Clinical Services, and she will share how AdamH's investments provide vital mental health and addiction services within Franklin County. Meg?
Thank you, Erica, and thank you for your time this afternoon. The AdamH network is a behavioral health safety net for our community. 110,066 people were served in the AdamH system of care in 2020. Approximately 41% of the consumers served by AdamH during 2020 were new to the Adam system, and approximately 81% of the AdamH consumers live below the federal poverty level. AdamH is the behavioral health safety net. 38% identified as African American or Black. The average age of the AdamH consumer is 36, and 47% of the AdamH consumers are women. In addition, we've been able to work with providers to leverage not only our levy funds, but state and federal fundings to bring services to the community, especially those that reach underserved populations. When we talk about the AdamH network of care, we're talking about a vast array of mental health and addiction services and supports that are delivered through more than 30 community-based providers. You see their logos here on this slide. There are 6 categories of services that AdamH invests in, and each of these has opportunities to support expanded access and increased quality. Examples of some specific programs include, in the category of prevention, you find the Suicide Prevention Hotline, along with key prevention strategies in all of the school districts across the county, serving all ages. Crisis services include inpatient hospitalization for mental health stabilization, as well as substance use withdrawal management. This includes our investment in mobile crisis with our law enforcement partners. Treatment is a category most are familiar with when thinking about psychiatry and counseling, and AdamH seeks to invest in evidence-based models of treatment, such as treatment for dual diagnosis. The housing services span a continuum based on the needs of the resident. AdamH supports transitional housing for individuals who are leaving an acute hospital stay, evidence-based permanent supportive housing, which provides a home with on-site supports, and an array of recovery housing to support sober living that eases a resident's transition back to their community. Recovery Supports offers an array of services that aid a consumer on their path to long-term recovery, starting with peer recovery supports. This category also includes vocational training and employment services as key indicators. Family supports are a category, and this service includes educational and support groups, a family advocate, an in-home respite that allows a caregiver to attend to other priorities or take a needed break. There is a strategy in AdamH's strategic plan to develop an investment plan for each of the systems of care categories. So we have clear priorities on how we will involve our investments over time throughout the levy cycle. In addition to levy-funded services, AdamH leverages state and federal grants to create local impact. The state opioid response dollars, or as they're known, SOAR, have allowed AdamH to provide deeper support to some of the hardest to reach populations. Some examples of this include access to drug treatment for new mothers through a maternal support team. This is a partnership with CompDrug and Physicians Care Connection that provides priority access to treatment while pregnant or at the time of birth. Investments in harm reduction and treatment linkage are being brought to the community through mobile outreach. Our partners in this effort are Franklin County Public Health and CompDrug, with teams focusing on those neighborhoods with the highest number of overdose and overdose deaths. And the newest initiative being provided under the state opioid response funding is access to naloxone throughout the community. This life-saving medication can reverse the effects of an opioid overdose and while awaiting the arrival of a first responder. And we are working with our community partners, including Columbus Public Library and Columbus Recreation and Parks, to offer a nalox box in public spaces. During the peak months of the pandemic, AdamH partnered with NetCare National Church Residences, Community for New Directions, and the Ethiopian Tewahedo Social Services Agency to connect individuals and families in communities that may lack access for information due to a variety of resources, including employment, housing, mental health, and food. A multicultural marketing campaign accompanied this effort, ensuring that individuals received information in their preferred language and from a trusted community partner. The program offered a call line available 24 hours a day to seek assistance. In a little more than 1 year, these agencies provided 12,195 counseling interventions, 14,203 opportunities for some brief education and support, and 3,785 community members participated in group counseling or a public education session. And that work connected our community with food, employment, COVID testing, vaccination appointments, and other things provided by our local partners. Up next is Jonathan Thomas, Vice President of Planning and Evaluation, and he will lead you through the crisis system of care, spotlighting our crisis center.
Thank you, Meg. So some of the most visible work you may note in the next year across the 6 categories Meg reviewed will likely be efforts related to crisis services. As you are well aware, work is underway on the new Franklin County Mental Health and Addiction Crisis Center, which will serve as the cornerstone of this continuum of care for adults in Franklin County, and we're targeting a groundbreaking for the new facility in Q2 of next year. While the new crisis center will serve as the central preferred destination for crisis care, it's important for us to mention that the new crisis center is just one part of this continuum. And you'll see AdamH leading other related efforts, including launching a pilot for community-based mobile response teams staffed with mental health professionals and peers to respond to crises that do not require EMS or other public safety assistance. And AdamH has been looking at how we can enhance the community-based call center infrastructure for our community. We're actively engaged with Ohio's planning to prepare for the launch of 988 as the nationwide number for mental health crisis calls. In total, hopefully you can see the planning and efforts underway to assure that everyone in Franklin County will have someone to call, someone to come, or a place to go when experiencing a crisis. And all of this informed our decision to spotlight the crisis continuum in our performance portfolio. Next slide. As for the crisis center itself, the community-wide planning efforts that we have coordinated over the past several years provided a very clear picture of what the needs for Franklin County were, and it allows us to build upon emerging evidence and best practices from around the country. A brief summary of what to expect at the new crisis center is it'll effectively have 3 distinct levels of care. One being a 24/7 walk-in clinic for services to lower acuity encounters. The largest service unit will be the 23-hour observation units. These will provide safe but open environments for stabilization, with the goal being to link individuals back to community-based providers through what we refer to as warm handoffs. And then the third level of care you see here is an inpatient psychiatric capacity. The goal will always be to discharge individuals in need of hospitalization to one of the many inpatient providers we have in our community. However, to best assure that the front door and the 23-hour observation unit are always available and that they don't go on divert due to capacity issues, what we've learned is having on-site inpatient capacity is a must for our planning efforts. The other services that will be available on the site and are on your screen now, these will be integrated throughout the facility and are not distinct service units, but these are services that will be available to anyone regardless of where they may be receiving the primary care at the crisis center. Next slide. The site that was selected for the new crisis center is on Harmon Avenue and was purchased by AdamH in 2019. Harmon Avenue was the most desirable location based on a zip code analysis of individuals experiencing crises, Columbus Police and Columbus Fire runs for mental health and addiction-related calls, as well as an analysis of ease of access for both first responders as well as public transportation, and then proximity to residential areas and emergency departments. On the next slide here, you see that we've accomplished several milestones this year, and we're excited to now have our implementation team for the Crisis Center full. We're currently moving through program validation, and we look forward to beginning schematic design sessions next month. but all of these accomplishments continue to keep us on target and on track for groundbreaking in Q2 of next year. And on the next slide, here you have a graphic that I know many of you have received different one-pagers and fact sheets for our project, and this illustrates that this is a $50 million capital project. We appreciate all of the community partners who have joined in the efforts to make this project a reality for Franklin County. Specifically, it would be remiss of me not to acknowledge how much we appreciate the $10 million commitment from the Franklin County Commissioners, as well as the invaluable in-kind support we've been receiving from county administration and several sister agencies, including Franklin County Public Facilities Management, the Prosecuting Attorney's Office, Purchasing, and the Office of Diversity, Equity, Inclusion. We do have a campaign underway to close the $9.5 million, and we've engaged Mullard Consulting to assist with our pursuit of corporate and philanthropic support. The last thing I want to highlight on this slide is you'll see in the graphic, it shows Adam H's commitment at $8 million for capital. We've already executed an additional over $3 million of additional contracts through our board to support this project. But these investments are in addition to the $6 million we currently invest in the services to be rendered. And we anticipate that the service rendering expense to Adam H will be $10 to $11 million annually beginning in 2024. With that, I will introduce our CFO, Patrick McLean. Patrick.
Thank you, Jonathan. Our first slides I want to show you are just a basic breakdown of our revenue budget and our expense budget. So what you see there is that the lion's share of our revenues come in 2022 from the levy, as they do every year. Federal funds include primarily pass-through funds through OMAS. Those include some of the funds that were talked about by my colleagues earlier, including $3.3 million for the state opioid response, or SOAR funds, as well as $2.5 million for substance abuse prevention and treatment. State funds also generally come from OMAS, and the local funds in this case are primarily $10 million out of that 11.3 for our anti-stigma campaign. On the expense side, about 11 out of every $12 go to providers. That's the single biggest takeaway that you should get from that expense budget. I'm going to break that down in the next slide, but hold on for a quick second. I just want to mention that when you do see this, the figures here do not include about $40 million in crisis center capital costs that will be we expect to incur. So to make an apples to apples comparison across years, we have excluded those from these figures. Next slide. Then that 92% that fell under provider services on the expense side of the last slide is here broken down by our system of care. The lion's share there, in this case, falls under prevention, crisis programs, and treatment. But you can see that we also have significant investments in recovery supports, housing, and family supports. I would note a couple of things about what's incorporated into this slide. So first of all, this represents a 3% increase in discretionary allocations year over year from 2021. Secondly, I would mention that about $2.4 million is incorporated here is incentives for outcome submissions. In other words, value-based contracting. I'm going to talk about that in the next slide. This also includes about $500,000 that's been set aside for provider capital projects. Next slide. So earlier you heard CEO Clark Jones talk about our second strategic priority, measurement of impact. 2022 marks the start of our efforts to implement value-based contracting, an important component in our efforts to measure the impact of our services. This slide shows the proposed schedule, which contemplates a 3-year implementation period for value-based contracting. starting with rewards for reporting in 2022. Ultimately, we hope that value-based contracting will do the following. First, expand access to quality care and continue to improve delivery of existing services. Secondly, support innovations in service delivery and technologies. Third, position client outcomes as central to the assessment of efficiency and effectiveness. And finally, continue the partnership between providers and payer to realize optimal behavioral health for all clients. So we've developed this internal timeline for rolling out VBC with best practices and with the levy cycle. And what we see and what this chart shows is that in 2022, we introduce these rewards for reporting. We move in 2023 to rewards for performance. And then in 2024, we add to that by having not only rewards for performance, but also penalties for lesser performance. And the final comment that I will make before I think we're turning it over for questions is that carrying out the programs and supports of the county residents and what our county residents need from providers assumes that they have the workforce resources to do that work. Workforce issues have really become a significant challenge for most of our providers, and we're starting to develop some dialogues with them, find ways to address these challenges. You heard CEO Clark Jones talk about this a little bit earlier, but I wanted to just mention it because it's something that's starting to impact almost everything that we're doing and talking about right now. So with that, I will end and say thank you.
I think, thank you, Patrick. Thank you, Adam H. team, commissioners, and guests. As you know, caring for the residents of Franklin County takes collaboration, it takes humility, and it takes a focus. All individuals and families can achieve optimal mental health and wellness free from stigma with equitable access to quality community-based services and supports. We continue to value our partnerships, not only with you all, the commissioners, and all the divisions of the county to achieve this vision. Thank you for your time today. We are happy to take any of your questions.
I guess I'll start off. Thanks for the presentation. I came in a little bit late. I was on my cell phone listening though, that I had to get in the elevator. So I apologize that you may have said this when I was in transition at some point. So forgive me if I asked a question that was where it was already stated. I think this question is probably for Pat. Can you just zero in on the budget increase? I know the crisis center has a lot to do with that, but it doesn't all add up to that. And can you just zero in on where the increase is mostly going to be concentrated at? And then the second question, I'll just go ahead and throw it out there, Ms. Clark Jones, is, can you talk a little bit about the collaborative strategies? I mean, there's a lot going on with the shelter board and different agencies, and I know you are connected to a lot of funding with them, but given the spike in mental health and addiction needs and services, I'm just curious at where the collaborative element is. And by the way, I'm really glad to see you add a legislative and policy person, because tracking public policy at the state level is critical to service delivery, and it's often overlooked. So I like that you added that. So.
Thank you, Commissioner. I know Patrick's on the call, and we also have other fiscal staff. Patrick, you want to answer the first part first?
Sure, I'll do that, and I may ask Mark Lambert to check in with me as well and share some of his additional thoughts. But Commissioner Boyce, you mentioned the crisis center, and there's an element of that. I would also mention that as the additional levy dollars kick in 2022, that's where we're starting to see more supports for the existing system of care. So the 6 categories that we mentioned earlier, we're simply expanding our efforts in many of those areas. And Mark, would you like to add anything in there as well?
Sure, I'll just add a couple of extra comments about that. We haven't actually increased our provider investments with our 33 or 34 providers in a couple of years. So we did increase across the board at 3%, which was roughly $3 million additional investment in that area. And as it was mentioned a bit earlier as well by Patrick, we're earmarking about $2.4 million for part of our value-based contracting incentive program. That's going to be to incentivize providers to submit outcomes not only on our traditional treatment services, which we've collected in the past, but also all the 6 system of care categories across the board. So we'll start collecting those submissions of outcomes on prevention services, treatment services, crisis, housing, recovery supports, and family supports. And as Patrick also mentioned, about $500,000 we set aside for capital projects with our provider network as well.
Commissioner Boyce, thanks again for the question. As you're right, there is a lot of collaboration happening across the board, and the pandemic has just underscored the need for continued collaboration, or quite frankly, being more aggressive in certain spaces. Since we're on the topic of crisis, we have a relationship with the law enforcement entities in our community. That's one really key example of not only our existing partnership, but reimagining what a future partnership might look like. As you know, we're in relationship with the Columbus Police Department and the Sheriff's Office through our relationship with NetCare as we design a co-responder model to crises. And actually, there are a couple of co-responder teams that operate currently in the space. We know, though, that needs to be revisited and redesigned for the future to make sure that officers stay safe, the individuals that are in crises stay safe, and that we have a good process that works for everyone. So that's one example of collaboration. Another example is schools and our work with the schools. As you can see from Patrick's pie chart, we spend a significant amount of money in prevention, making sure we are identifying early onset of mental illness, discouraging use and abuse of substances. And so we work with all 16 school districts within Franklin County. We continue, our investment remains firm. We actually, in 2021 and 2020, had a significant investment from the state to expand our prevention efforts in the K-12 space. So the relationships with schools is pivotal, especially as we see families and students struggling from the impact of the pandemic. So that won't change. If anything, especially if we can divert investment to evidence-based practices, that may increase. We talked about the collaboration with our housing providers. We've always had a relationship with our housing providers, but we're starting to think a little differently and take advantage of some innovative concepts in partnership with the Community Shelter Board and Columbus State Community College, and thinking about how we develop a workforce or even a new workforce credential that prepares the staff that are working in our shelters and our congregate settings and our permanent supportive housing units to better address crises that the residents are experiencing. As proposed, it is a 3-year plan that would we would review it at the end of 2024. I know the proposal on the table in front of the commissioners and at the City of Columbus, I think they recently passed, would be to use the American Rescue Plan dollars to be able to develop this program. Adam H's interest in this is that we approach this program with rigorous evaluation. We want to know, we have some goals that we are interested in, not only the pipeline of mental health professionals and the credentials they would have, but is this indeed helping those folks in need? And are we able to reduce the number of incidences that are resulting in violence against the staff, increased suicides, and police runs to those settings for mental health distress calls. So we're looking forward to that partnership and what it can bear out. But again, we have an emphasis on the evaluation of that program so that at the end of 2024, when we have had a good 18 to 24 months of this program in action, we can see exactly the things that work and then continue to invest in those for the long run. And then lastly, the issue of workforce. Patrick brought it up. I'm sure you all are hearing it again across the board. We are very much interested in collaborating with our higher education institutions, as well as the Workforce Investment Board, to build out a pipeline that starts to identify and attract young people interested in serving in the behavioral health field and getting them early supporting supporting them with internships, and really introducing them to the community behavioral health network and having them serve alongside our professionals that can mentor them and keep them in the field for the long run.
So, I mean, you brought up something earlier. I thought you were going to go a little deeper into it, and maybe this isn't the right forum for it, but I'm still very interested in the collaborative element with the sheriff and CPD with regards to the jail. You know, as folks come into this this facility, the ability to triage them to services they need, specifically mental health and addiction services, are just critical to even to the administrator, to our from our budgetary standpoint in terms of the jail. And so I'm just keen on that relationship. What is that going to be like, given we have this new facility and the ability to sort of think differently about service delivery when it comes to managing the jail system. So maybe this isn't the right forum to get into, and I feel like seems like you all are headed on the right track and everything else. So I just hope that conversation is really taking shape, so that when we open, there's a real triage system set up there.
Thank you, Commissioner. Squarely on our radar. I know we have staff that are managing that relationship, and we want to learn more. And we actually, that we're invested in the outcomes of the individuals that are moving through that facility. I have to say, I've recently had the pleasure of being with Mark Hunter from Public Facilities Management. And I said, I haven't even seen the new jail. I need a tour. I want to see how it's going to operate. So we're looking forward to being able to get out there, see it, and talk through the services and the processes that we're going to be using in that space and how we can.
That kind of scares me a little bit, because again, I think the design of that jail and the way we deliver services, you are very much a crucial part of it. And the programmatic part is one thing, but even the infrastructure, the actual infrastructure itself is critical, because there may be parts in the way we process people coming in that really are best practices in terms of where you fit in, where your system fits in to that evaluation. And we want to make sure we get that part right, because sometimes the beginning can really be a crucial aspect on how well someone's experience is through the system. And, at the end of the day, it's about recidivism, trying to get them the ability to not return, to be functional and non-deviate behaviors that led them there in the first place. And I just think that if we got to get you out there ASAP, because there could be pieces that are designed in intake that can be all the difference for functionality for someone. And so I really, Administrator, I really want to get these dots connected with the sheriff and Adam H, so that this really, we have an opportunity to make a different kind of mark in this conversation than we have in the past, and I just don't want to miss it.
Thank you. For sure to do that.
President, this is County Administrator. Certainly, President Boyce, Commissioner Crawley, Commissioner Gray, we definitely want to be coordinated, particularly since we're just a few months into a transition to a new complete medical care provider that will be transitioning to the new facility. And we certainly would want to, have advice from Adam H and Adam H's partners, working along with our new medical vendor within the new correctional facility. Because once they're there, we definitely need to make sure we're following the best practices. And then there needs to be continuation of the community collaboration as a part of the Stepping Up initiative. And the Mental Health and Crisis Centers will be one of those tools to where we divert individuals in the community away from the jail whenever appropriate and get them in the right type of treatment, and to keep them in that treatment to increase the number of folks that avoid that endless cycle of the revolving door in and out of our correctional facilities. So certainly, those community collaborations will be important. a significant part of the increase in this recommended budget for Adam H is almost $10 million for a multimedia mental health and wellness campaign, where we are part of a statewide effort there around eliminating the stigma. But this crisis center is definitely one of those features, and we got to make sure we get that built. And there's definitely linkages to reducing the number of intakes in the work that led up to that. So collaboration and all these, working with all these community partners are gonna be essential as we move forward.
Great. Is Chris Long on the line?
Yes, she's on. President.
Yeah, I want to just, Chris, if we could just really quarterback getting this.
Absolutely.
To set up a tour. It starts with a tour and then should lead to a deeper conversation. And I'd very much like to be a part of that too, Tamara. I know she's watching, so if it can work out, don't hold it on my schedule, but I definitely think there's a valuable opportunity here. So it'd be great.
Absolutely, Commissioner. And we'll
Thank
make
you.
sure that we quarterback that, and with the Director of Programming at the Sheriff's Office, in addition to the deputies that are working through that.
Thank you.
Commissioners, are there any other questions for Adam H? Hearing none, I'd like to thank Erica and her team at Adam H for today's budget presentation. Commissioner, if you're ready, we can just take a couple minutes. We'll get everything set up for the Health and Human Services panel and then begin here in a couple minutes.
Thank you, commissioners.
Thank you, team Adam H.
Thank you.
Thank you.
Happy to serve.